Hello and welcome back to Full Circle Fitness, brought to you by Circle Health, providing complete connected care to Westford and all of Greater Lowell. My name is Will Courtney, and if you've seen this show before, you know we do a lot of different things. You might see a fitness expert like Shane Lazar taking you through interval training. You might also see me trying prenatal yoga or trying to swaddle a baby. But today we're doing something a little more serious. We're doing some new territory with two Lowell General Hospital physicians who are breaking new ground in cancer care. Doctors Leisha Joseph and Anasuya Gunturi are partnering on a new program that allows cancer patients to see the cells that are invading their body. It's a first-hand approach that is allowing many of these patients to get an experience that will help them prepare for the fight ahead. As one patient told Dr. Joseph, they want to see the dragon that they're going to slay. We'll be right back with the doctors. And we're back on Full Circle Fitness. I'm here today with Dr. Leisha Joseph and Dr. Anasuya Gunturi from Lowell General Hospital. Dr. Joseph is a pathologist and Dr. Gunturi is a medical oncologist in our cancer center. Thank you both for coming. And we're here to talk a little bit today about the cancer and pathology relationship at the hospital and a new program that's really getting some national notoriety, something different and something that's really unique to the Lowell General Hospital Cancer Center. So again, thank you both for coming, and maybe Dr. Joseph, you could start and just tell us a little bit about yourself.
So I'm a pathologist, board certified, started at Lowell General in 2010 and has been a wonderful experience working with the Cancer Center. It's a really fantastic group of physicians that I work with, and it is very fulfilling to talk to them and interact with them, as well as now with the patients for the past few months.
Mm-hmm. And we talk a lot about at our hospital about our cancer center and how it's unique and really provides amazing care right here in the community outside of Boston. Dr. Kanter, you're a medical oncologist. Maybe you can tell us a little bit about how you came to Lowell and why you're here.
Yeah, sure. I'm a medical oncologist. I trained in Boston in one of the hospitals there in Longwood, and came here to Lowell General to join the Cancer Center. There are other medical oncologists like myself, and it's a thriving practice. We work with so many other doctors, including pathologists, radiologists, surgeons, radiation oncologists. So it's really a multidisciplinary situation where we're trying to provide the best care to the patients, and it's been fantastic working for this hospital and this cancer center.
I think it's a good point to mention that the doctors that are here in Lowell are training right alongside the same doctors in Boston, and people, I think we sometimes talk about the Boston brand, and really it's you're training the same everything. And when you mention the multidisciplinary approach, I think it's worth sort of telling people a little more what that means when that initial diagnosis and that team that comes in. Can you talk about what happens there?
So usually a diagnosis of cancer, takes everyone by surprise, obviously, and it comes about usually when the patient has some sort of symptoms, and usually some sort of scan or an imaging study is done. So radiologists are very critical in that stage. Then we usually do a biopsy to get a piece of that tumor that we think is happening, and that's when the pathologists get involved. They look at the sample, look under the microscope, and give us a diagnosis. They tell us what kind of cancer it is. And then from there, usually it's the medical oncologists along with surgeons and radiation oncologists. So surgery, radiation, and medicine or chemotherapy are usually the three main modalities in which we fight cancer. And so that's why it really involves, all these different physicians to come together to take a patient from the beginning of diagnosis and then start the appropriate treatment for it.
And when you put that treatment program together, that's really a team approach as well, right? I mean, it's not just one person looking at your case, it's a whole group of people.
Absolutely. And depending on the type of cancer and the stage of cancer, basically means how far has it spread. So based on the type of cancer and the stage of the cancer, we figure out together what the patient needs. Do they need surgery? Do they need chemotherapy? Do they need radiation? Or some combination of all three? And to get this done, like you said, it really is a multidisciplinary approach. We have many meetings where we sit and talk about cases together. We have the pathologists and radiologists also come to these meetings, and through that approach, we're able to provide the best care, the best treatment plan for the patient.
That's great. Now, Dr. Joseph, you've told me about the doctor's doctor and what a pathologist does, and I think the medical oncologist is often the one meeting with the patient and the one the patient knows. Can you tell me a little bit about what you do and your role in that process?
So often when we get the tissue biopsy, we are actually right beside the interventional radiologist while they're performing the procedure, so that we know that we have enough of the tumor cells that is necessary to do all the workup that needs to be done. With more and more of combination therapies as well as newer treatments that are available, it is important that the patient is not subject to multiple procedures. So we are right there, right beside the radiologist as they take the tissue. And even further down, once we have the tissue in the laboratory, we process it, make sure that every test that is done, is possible to be done on that tissue is done, so that the oncologist, when they see the patient, has all of their tools available right when they meet the patient, so they can treat the patient appropriately. So that's what we do routinely. And one of your biggest tools is a microscope, right? You're really trying to get that view of what's going on. Yes. More and more beyond the microscope, even molecular pathology and chromosomal and gene level studies are necessary these days for providing the appropriate information for the medical oncologist. So yes, we do deal with the microscope, but we do also do a lot more than that. And technology is probably bringing that along. Yes. So we're here partly to talk about a new program at the hospital that is allowing patients to sort of get a closer look in that microscope or on a monitor to once they've gotten a cancer diagnosis, to see what's happening there. Can you tell me a little bit about how that program came to be and what you were hoping to accomplish? Yes. So as a group and as a group of pathologists, always keeping up with what is out there going on nationally in the pathology field, we needed to find out what's going on in pathology and the social media. So we invited Dr. Matt Katz, who is a radiation oncologist at the Cancer Center, to give us an overview of social media. And he is very active in social media, and he's one of the top 100 social media doctors in the country. He's published papers about social media. So he gave us an overview of how to navigate social media and medicine. And one story that was on the social media caught my attention. It was a patient who's based here in Lowell, who had to travel to a nearby city in Newton to look at her slides. And so I thought to myself, no patient in Lowell should have to drive all the way to Newton. We could do the same thing here. And that initiated that conversation with Dr. Katz and Dr. Miselek in Newton. And that's how this program started.
What was interesting to you about it? This was a chance to, in a sense, as you have said, get in front of the patient, sort of have that one-to-one contact, but it means you started to learn about what that meant for a patient as well.
Yes. So, of course, this is not a program that is widespread in the country. Yeah. It is one of the first programs in the country. So I had to do my homework, reach out to administration, reach out to risk management, reach out to several departments at Lowell General to make sure that I am doing it right, and also speak with marketing and other departments to be sure that this is done right. Mm-hmm. In that process, though, we did realize that within the pathology department, we needed to provide a safe space for the patient to come. It should be secure, it should be private, and they should have access to look at their biopsies either through the microscope or on a computer screen. So it took us a couple of months to set up the whole thing. But beyond that, it was exciting for me to maybe start to encounter a patient, because we all started the journey in medicine to help a patient. Although we know that as pathologists we are helping a patient, we have always been invisible behind the scenes. So I was excited to meet a patient.
Dr. Kanter, could you see where a patient would be interested in seeing this? I mean, it's not something we've heard about before. They may not even realize they have the option.
Yeah, no, I've actually referred several patients to this, and I've had nothing but great feedback, positive feedback from all of the patients that Legia had met. So to answer your question, yeah, it's probably not for everyone, because for some patients, too much information may be hard for them to process and deal with. But there are several patients that I think really look forward to really understanding their disease at such a microscopic level, and Legia has done such a great job explaining it so that anyone can understand what's going on with their disease, and it really adds to their overall satisfaction with the care that they get at our cancer center.
Every piece of it. And just to be sort of in a synopsis, what's happening is when a cancer patient comes in and gets diagnosed, we're offering them the option of basically seeing their cancer cells.
Right.
This is not something you'll find most anywhere in the country. And it was something that you didn't really know what the reaction would be, right?
Yes. Honestly, when I started the program, I thought maybe a patient a year would show up just out of curiosity. But within 6 months, we've already had 18 patients who have come to actually look at their biopsies.
And you said it's been a wide range.
It's been a wide range. It's mostly been patients with cancer, although it's on the website, any patient who wants to look at a biopsy, whether it's cancer or not, this option is available to them. It is free. It's a half-an-hour consult, and it is organized such that it is connected to or tied to another existing appointment at the hospital, so they don't have to make an extra trip. So they come. Most of the patients have been patients with breast cancer, but we've had colon cancer, lung cancer, bone marrow type, multiple myeloma. So it's been all types of cancers.
And different ages, different...
Yeah, the youngest patient was 13, oldest is 86, and they're all eager to confront their disease.
Well, what is the quote that one of them gave you one day?
Yes, one patient with breast cancer said it the best. I know that I'm embarking on a long journey, but I want to see the dragon that I'm slaying. Please help me see the dragon that I'm slaying.
And is that a common thread through all the different people that you've met with?
Pretty much most of them are coming to truly understand their disease. Some of them definitely have interest in science or biology. Some of them have considered a medical profession. So there is a certain type of patients who do come to see their dragon.
Yeah.
But honestly, nobody is coming to see, did you make a mistake? Or they're coming to truly understand their disease.
Is it an emotional thing for them? Is it more of an intellectual reasoning kind of thing, do you think?
I think predominantly the patients are intellectually trying to see what it is that they have to deal with. There has been maybe a couple of patients who were anxious.
Yeah.
We were able to help a couple of patients who were seeking a support group or something else through this process that I was aware of, that I could connect back to the oncologist so that they can provide the support they need.
Right, right. And is their reaction typically sort of curious, or is it more emotional? That they when they first see that, are they just trying to understand what they're seeing?
Most of them come with a loved one, and they are emotionally prepared to see what they're going to see. And we try to keep it low key. We don't use big words, and we try to speak a layman's language and help them. I try to ask them, what is it that you have come here to see? And I specifically answer their questions. So some of them come with a list of 15 questions. Some of them just want to see because they are visual learners, and they say that I can understand much better when I see rather than somebody just speaking to me. It has not been a lot of emotion.
Yeah.
They have heard the diagnosis from somebody else, they have internalized it, and now they are at a stage when they want to tackle their disease. And that's the stage when they're coming to us.
Trying to empower themselves almost
Yes.
as they get ready to take this on.
Yes.
At the hospital, we talk about, in our cancer center, we treat the person, not just the disease. I think this is a great example of that there's a psychology aspect to this, to a cancer diagnosis. When you have to deliver that news and you give, what goes through your mind, and what are you sort of sensing from the patient, and how you're trying to sort of get them comfortable with this information?
Yeah, like I said, I mean, nobody's prepared for this. It's a diagnosis that scares people. So when the first meeting happens, a lot of it is spent in explaining to them, what is the diagnosis? What does it mean? What are the next steps? Answering any fears and questions that they may have. And I always try to make it clear to them that I'm sure we all have somebody in our lives that have been affected with cancer, and unfortunately, some people don't survive this diagnosis. And to remember that other people's experience doesn't necessarily mean that's going to be your experience, because every cancer diagnosis and situation is unique. And so trying to make people understand that, and help them embark on this journey, like you said, is really my main mission during that first meeting. And I also try to make it clear to them that there's a whole support structure that's in place in the cancer center. It's not just me. I'm the medical oncologist, but there are also other physicians. They're excellent nurses. If they need chemotherapy, we have a chemo infusion room. Again, beautifully run with so much of dedication and care for the patient. We have social work. We have nutritionists. We have so many things I can't even just list. And every single person, from a nurse to a staff member to the physician, everybody's main goal is the same, which is to help the patient, treat them as a human being first and foremost, and help them through this journey that is so difficult, and one that most of us are probably in our most vulnerable state in. So it's really wonderful to be part of that team, and I try to make that clear to the patient and their family.
I think one of the things that I've heard a lot about is the Navigators who come in, and you're in this such a vulnerable position, you're scared, and maybe you're not listening as well. There's this person who just steps right in, right?
Yeah.
What does a navigator do for these folks?
Yeah, it's actually very critical. Like you said, people are overwhelmed. It's hard for them to take in all the information. Most of the time, they do come with a loved one, a family member, a friend, so who can, sort of help them with this information. But as a cancer center, we also have navigators within our cancer center to help those who need it. And basically, they're calling, they're setting up appointments, they're making sure that the patient knows what the next step is, basically bridging the gap between the services and the treatments that we have to offer and the patient who needs that extra help to engage in this process. So I think as physicians, we do rely a lot on the navigators to keep the connection, and help people navigate this difficult process. And
not feel like that's part of their, it's a job in a sense, managing your care in such a serious situation, and these folks really sort of take that pressure off.
Yeah, I mean, to this day, I am amazed at what my patients have to go through. I mean, I'm so focused on their treatment, but they have to deal with their emotional well-being. They have to deal with their dependents. Oftentimes they're working, and they're worried about what will happen when they don't go to work, and child care and elderly care and all the other people that are dependent on this person. Financial burden. I mean, it's just amazing to think about all the different things that they have to take care of. Transportation, things that we often take for granted, and I can't treat a patient unless all of these other things are taken care of, so they can come to the cancer center for the treatment. So I think the cancer center is really committed to making sure that yes, we'll provide good treatment, but we'll also help you get it. We'll help you come here to get that treatment. And so I think again, navigators and other people that are part of the team are very crucial in making that happen.
How important is it to a cancer patient who is going through all of that to be close to home, as opposed to trekking in and out of Boston? Yeah,
no, it's extremely important. A lot of my patients are, so relieved to be able to get the treatment close to home, so they're not spending, an enormous amount of time on the road, navigating the parking situation in a big city, and even the buildings there are sometimes very scary and daunting to the patients. Once in a while, we do have situations where I do recommend that they go into Boston for a second opinion. Maybe they have a clinical trial there that we don't have here. But I would say, it's rare. I mean, the situation, maybe arises 10 to 15% of the time. I would say the majority of the cases and the treatments we have right here in Lowell. We have an excellent cancer center. We even have clinical trials and research that's going on here. So even that they can tap into. And like you mentioned before, a lot of the physicians that do work here, we're all trained in Boston or other, reputed academic institutions. So I really, truly feel that the care is not compromised at all, and it really helps the patients spend more time at home with their families and less time on the road and getting to treatment, and then at the same time not compromise on the standard of treatment.
Well, us marketing guys like to use the slogan, put patients first in everything you do, is one of our missions at the hospital. And I know it really permeates a lot of what we do. You said how much the administration and our hospital has supported this. Can you tell me a little bit about that?
So when we started this program, we really did not have a framework to work with, because it was brand new and it was just an idea and had to make it happen. So reaching out to several people, right from Jody White, the president, and all the way to the risk management marketing department, cancer center, several people at cancer center. Every single one of the people that I reached to was extremely supportive, and I really want to highlight how the hospital puts the patient first in everything they do. They recognized that this is something that even a single patient could benefit, and they were able to give me 100% support to truly make it happen. And I cannot say enough about working in an environment like that. It is very fulfilling as a physician when you have a group of people who are administrators but are very vested in that mission. I'm very happy to be part of Lowell General.
It's one thing to say it, right? And it's another thing to actually do it every day.
Yes.
What is some of the, as this program has evolved and the word has gotten out a little bit, can you tell me a little bit about the reaction you've gotten from colleagues? Or, it's really been pretty widespread.
Yes, I never thought that I would be famous. But, my mission truly was, once I recognized that there are patients out there who are eager to see this, I did reach out to a pathology magazine that is published by the College of American Pathologists, which is a national organization that accredits most of the laboratories in the country as well as internationally, and told them the story, and they were willing to publish a interview and a story based on that interview in one of the magazines called CAP Today, CAP Today.
Goes out to the pathology community.
It goes out to the pathology community, but somebody else in the healthcare media got hold of that article, and now a hospital network media person, Mr. Blair Walker, has now published the story in that magazine and Hospital Magazine, and now many people are calling me. There are pathologists who read that story in the Pathology magazine and actually reached out to me from Kentucky, Arkansas, South Carolina, from pretty much all over the country, trying to see if they could start a similar program. And with this, my friends and colleagues and Facebook, social media is also catching on to the story now. The hospital employees are sending me emails saying that they're so proud of me and they're so happy that we are doing this for the patients. So it's kind of gotten out there. It was not intentional.
It's wonderful, and it really speaks to the work being done at Lowell General and the willingness for them to sort of take that first step when maybe others hadn't. We're actually getting almost out of time, but I wanted to, if people wanted to learn more about this, where can they look? Know we have something on the website about this?
Yes, the hospital website as well as the pathology department website of Lowell General Hospital has, all they have to do is pick up the phone and call a number, 978-937-6341, and our team will then take it from there. So the information is on the website.
And so lowellgeneral.org is where you can find that. It's been our privilege to have the two of you here and making time out of your day when you're working so closely and helping patients. So we really appreciate you coming. Dr. Kanter, thank you. Dr. Joseph, that's it for Full Circle Fitness today. Thank you for joining us, and we'll see you again next time. Thanks.
Thank you, Will.
Thank you.